Definitely. Thank you so much for introducing me. A little bit more about my background. So I'm 32 right now. I used to be a nurse for 5, 6 years at a hospital, working at a hospital. Obviously, I didn't have a very healthy lifestyle, even though I was helping out to the patients and to other people. So back then I was around 25 years and everyone thought that I was 35. But now that I say to people that I'm 32, everyone will it's like a shock to everyone that how come you're 32? We literally thought you're 25. So mind you, the reason that I'm sharing all these things, a little bit about my background, just telling you like how I changed my lifestyle and how I like to help other people to change their lifestyle. So I had a couple of injuries, massive injuries. I had hip injuries. I had to go through a massive surgery to have hip replacements, and then the outcome was not be able to walk properly or just do like normal activities. But I've done lots of research. I did lots of physios. Obviously, I got into fitness because of that. And then throughout the years, I helped out myself. I started doing running. I did marathon, half marathon. I did Kokora Trail. If you guys know, it's 100 k hiking in 9 days. And then just before COVID came to Australia, I did a powerlifting as well. So what I'm trying to say is, if you change your lifestyle, you actually can look after yourself and you can do the things that it's not even come to your head, and you can do even more. Your ability about life and doing stuff would be even more than what your capacity are right now. So one of my focus today that I'm going to talk about today, and then I'm happy to answer any question about it, is to be honest, everyone has suffered. A lot of people have suffering from lower back pain, and that can cause a lot of other issues. One of the main common things that comes from lower back pain is pelvic floor. So I'm just going to talk about pelvic floor today, and what the understanding of what is the pelvic floors are, what are the common symptoms, and how we can come out of it. How can I help you at exercise lifestyle that you can help at yourself to bring that pain on your lower back quite down. So I just want you to understand, it's very common in the society, but nobody talks about it because it's a topic that it might be very stressful. You might be nervous and quite I've got a couple of clients that are very ashamed of talking about it. But what I'm trying to do is it's okay. It's a symptom that we all might have it. Every 8 guys, every 1 in 8 guys might have it, and it's very common in ladies as well. So every 3 women in the whole world, one of them has the pelvic floor. It's really common with the woman because of going through the pregnancy, giving birth and stuff. So 50% of all the ladies, they have the pelvic floor, and if they don't talk about it, it brings up all their weight gain, as I said, lower back pain, emotional stress of relationship problems, lack of confidence, anger and anxiety. So it's quite massive. It's a massive topic that we can talk about it. So what is actually pelvic floor is? The pelvic floor is the muscles that can control our urinary and the bowel movements. So these muscles are going through all the pelvic. So whatever muscles are going through your lower abdominal all the way down to your lower back is pelvic floor. Their function is to support the pelvic organs, to bladder control, bowel control, pregnancy and childbirth, the sexual function and part of the core. So what is the healthy bladder and bowel? So if you think about the day, if you're going to urinate every 4 times per day, or having not going to urinate at nighttime or up to 1, you have a healthy bladder. Other than that, you do have a pelvic floor issues. Same thing with the bowel. If you're going to open your bowel 1 to 3 times a day and nothing at night, you are having a healthy pelvic floor. Other than that, you won't have it. And then be mindful, like pain, it has to be pain-free. Even during the sexual intercourse, if you do have pain, no matter guys or ladies, it's okay to talk about it. Like we should talk about it. The symptoms are, it would be very, very heavy, draining, like, lower back pain, or even in front of your belly. If you think about your belly, lower than your belly, if you're feeling really pain. So these are the symptoms of having the pelvic floor, as well as the lower back pain. Sometimes you're feeling so drained, running down. You feel like, your pain is coming down from your belly, pulling you down, and then it's actually more heavy at nighttime than in the morning. So that's all the symptom of having the pelvic floor issues and problem. So let's say how, like, the treatments. Let's talk about the treatments. So obviously the first thing that everyone comes to their head is the surgery. So even though if you go to your doctors and stuff, that will be the quickest way to fix this problem. So they will recommend you to go and see a surgeon. You go through a surgery, no matter how much you're paying. So that's a quick way out of it. But let's talk about other things. So you can actually, by changing your lifestyle, you can come up out of this problem. So having more fiber in your food, let's say like fresh vegetables, controlling your drinking water, or what type of drink are you drinking, less sugary drinking, like, if you're drinking orange juice or like, Coke and stuff. These are all the sugar stuff that can cause a problem. Let's say you can do like some of the very, very simple exercises just to come out of these problems. Sometimes like by lifting heavy objects and you don't know how to do it, if you're not doing it correctly, you can put a lot of pressure on your pelvic floor, and then down on the track, you might come up with lots of problem. So as you know, like before 30, you guys are like, everyone's doing everything's beautiful. Whatever you eat, you burn it out. Whatever heavy object that you are lifting doesn't matter. The second you go after 30, everything drops down. Why? Because all the muscles that we have, we started breaking them down. Like we need to keep them up by having our lifestyle, by exercising, by eating correct source of food. We can actually come out of it. So I just want to show you how we can, like, do these type of exercises. Basically, like if you point your 2 fingers and pushing it down between your hips, if you do it with me right now so you can feel it. So placing these 2 fingers, find those hips on your pelvic and push your fingers down. So you will see a little cavity down there. So what I need you to do, to take a deep breath in, push every organ down. By breathing out, try to lift everything all the way up to the point that you're feeling it on your fingers. Squeezing it up by breathing out, and breathing, relax everything. Again, breathe out, lift all the muscles up, and breathe in again, relax again. Just do that like a couple of times in a day, and you can actually lift everything, and you can actually get this muscle working, and you are not going to have pelvic floor later. If you want to go like, a bit more advanced and stuff, I can help everyone out with it, with some training and stuff. But this would be like, the basic things that I can show you right now. So if you got any question about this, I'm very happy to answer some questions.
Sami, I have a question. So,
Yes.
During my exercises, especially in deadlifts, there
Yes.
are, cases wherein I do feel that stiffness in my lower back or my, in pelvic area. I still do, a lot of cardio before I straight go to the, say, weight training programs. So
Yes.
is there a specific reason why I feel that stiffness around my, lower back or pelvic area, or is there something
Definitely.
that I should take care of?
Definitely. So that was actually a great question, because if you're deadlifting heavy, if you're exercising, you might like actually your pelvic, your muscles are very, very strong. So that's why you're feeling it. So there is two different aspects. So it's either very weak that you're feeling it, or they're very strong that you're feeling it. So how we can release this muscle. So are you wearing any belts when you do deadlift? All right. So
Yes.
I need you to loosen up that belt next time. So make sure that make sure that your two finger goes down into your belt, and then brace your core. How you can brace your core? Take a deep breath in through your belly and push everything out to that belt. So that can help you to compromise that lower back pain when you do deadlift. So again, that was a great question, because if your pelvic muscles are weak, you feel it a lot. If your pelvic muscles are extremely strong, then you feel it again. So in your case, I would say just try to activate your core before you started doing deadlift. So the exercises, for example, dead bug. I'm not sure if you have dead bug or not. Have you done it or not? So you're lying on your back, you're placing your feet on a tabletop, you're taking a deep breath in through your belly. Make sure you place a weight on your belly. When you breathe in, so your belly has to expand. So that weight has to come up. And then you breathe out, that will go down. So if you can do the same thing when you have your belt around your belly, it will take off the pressure on your lower back.
So is it with the help of the hip thrust to raise the weight?
Yes. So whatever you do with every exercises that you are going to do, like if you're using the belt, even without the belt, I would say just lie down on your back. Take a deep breath in through your belly, because we always take a deep breath in through our chest. So if I want to say take a deep breath in, you go and down, right? So it comes through the chest. But if you're doing that, when you're doing hip thrust, squat, deadlift, whatever you do, you are not bracing your core. So what I need you to try to do, grab your hands around your belly. Now take a deep breath in through your belly. Go and down. You see your chest that should not go up and down. So you are not expanding the lungs. You are actually expanding your belly, your organs, your all the muscle around your belly to protect your back. That's another exercise. That was a great example that you said. That's another exercise that you can do.
Great. So I guess we have Indranil and Kishore. Do you have any questions right now for, say, any of your physical activities?
Nothing as such, Sumit, but I really appreciate the information that you have shared with us, Sami.
Sure, you're welcome.
Great. So Sami, I also have a small question. So I've just recently, started running as well. So do you think to improve the overall, running capabilities, there has to be some kind of stretching or some kind of movement that should be done to increase the overall, stamina to run?
So how long are you running for usually?
I think it's been only a week, I would say, since when I started running, and on an average, I do a running of say 1.5 to 2 kilometers in one go.
Okay, in one go. So and then do you run how's your pace? Like, is it steady, or you go run fast?
It's steady. It's steady. So basis the the calculation that I have, it's around 6 kilometers per hour, or at an average
All right,
speed.
that's pretty good. So for stamina, if you are going to bring your stamina up, you actually the way that you have to train is if you're going to do a long run, so I would say sprint and then go on a steady run. Again, you go sprint and then you go on a steady run. So you actually need to bring your capacity up, your stamina up, you need to bring your lungs and capacity up. So how you can do it, you have to push your body in a pressure. So you cannot put that pressure on when you are going steady. Like let's say in 5K, if you're going steady the whole time, you're not going to get anywhere. But if you say, let's say you're going sprinting for 20 seconds and then you're going to run very steady for a minute, again, 20 second or 30 seconds. So you have to start with a 20-second, and then you build it up to 30-second, and then in minutes. Like, you need to challenge your body by sprinting, not by steady running. And then obviously, if you're going to run, it's really good to stretch before to loosen up the muscles, especially your calf muscles if you're going. So and then the strength training on the side will help you a lot. So make sure you do those deadlift lunges and calf raises would be the best for running. And then don't forget to do some back workout, because the whole time you have to keep your arms up. If you are dropping your arms down, it will bring your speed down. So it doesn't really help you to get to where you want to go. So you might have the lungs capacity to run, but your body is fatigued. So you actually need to do some pull-ups, to do, like, I'm not sure what you have, like lat pull down, seated row, even chest workout, to make sure that your arms are holding up and your shoulders and your back are helping out to that running as well.
And also, Sami, while we run a lot, and anyone who's trying to run a lot, there's a basic tendency, while we start running while breathing from nose, and then I think all of a sudden we start breathing from mouth.
From the mouth,
so,
yes.
Yeah. So why does it happen? How do you think you should control it?
It's a mechanical, because like you're trying to get oxygen as much as you can. So obviously breathing through the mouth, you cannot get as much as oxygen. I try to start breathing through the mouth no matter what, because I need that oxygen to keep up my running. That's the only reason. Like, your body is just like want to suction all the air that can possible because of you running. But over the time, as you get better at it, so you can control it, as it won't happen, because you just started, as you mentioned. It will get better. It will definitely get better. Keep it up.
Thank you, Sami. So I guess we don't have any questions from the members, and I've also dropped a text on our Facebook page. In case anyone comes up with a question, of course I'll route to your page, or maybe I'll get your Facebook page and I'll tag you in those queries as well. I guess Indranil and Kishore, if you want to ask any questions, you can. And after this, we can end this session,
right,
and maybe
now.
we can arrange.
Not
Yes, Kishore.
not right now.
Great. Kishore, thank you so much. Indranil, thank you so much for joining into the webinar. Of course, this is not just first session, as I'm sure you must be there in couple of many webinars as well. There's a series that we always do in a monthly basis, and this is the first session that we've done with Sami, and many more will be there to come to have your questions and concerns. Thank you so much, Sami, for having the first session with us, and happy to have more such sessions in future.
Definitely, it will be very, very helpful if someone if you have any questions later on, or if any topics that you guys want to talk about, so I can talk about. As I said, like I've got the border of like massive topics. It's just hard for me to pick which one. So I just want to understand, like, what people need and what they want to know, so the next time we come up with something better.
Absolutely. So Sami, next time we will have something like, say, something around nutrition, or something around exercise. So we will have a specific topic to choose from. Yeah,
definitely, we'll do that.
Thank you, Sami. Thank you so much for coming on board.
Thank you so much.
Thank you, everybody.
Have a lovely day. No worries. Bye-bye.